Welcome to the common issues video for our knee. So we're going to talk about kind of a bucket term that I think a lot of knee issues get placed into, which is patellofemoral syndrome or chondromalacia patella. I don't think that gets used as much anymore. But so essentially wear and tear of the knee. So the knee joint, as everywhere in the body, but the knee joint in particular, it's very crucial for there to be balance in the knee joint. So what I see a lot is that there becomes an imbalance between our medial and lateral side of our knee. So a lot of times, the things that we do in our culture lead to overdevelopment and tightness of our lateral leg. Running, biking, hiking, all those things sort of develop our lateral quads more. I'll show you this video. This is your knee with all the musculature taken off. Remember how I said in the anatomy video, your quad comes down and sort of suspends your patella and then attaches down to your bone below. So when you go through flexion and extension of your knee, that bone, that patella, has to track in the groove. And what happens if the lateral side, so this is the outside part of your leg, if your IT band and your quad on this side are too tight and your vastus medialis, your VMO, remember that muscle that I showed you on the inside, is not strong enough, your patella will track off to the side, to the outside part of your leg. So instead of sitting nice in this groove, it actually starts to sit too far off to the side. And then you get wear and tear underneath the patella on those cartilage surfaces. So this is just going to kind of show you what can happen when it's tracking too far off to the side. So your IT band's tight, your lateral quads are tight, your VMO is not strong enough to keep it pulled over this way. So now we start to get irritation on the underneath surface of that patella and on your femur. Essentially, arthritic changes, right? Or just degenerative changes to the underneath side, to that cartilage underneath. So this is essentially patellofemoral syndrome, right? It's irritation to these underneath structures of your knee, and it's because of this imbalance where the outside structures get too tight, your IT band, your quads, they pull, and this VMO and these inner thigh muscles are not working hard enough to pull the patella back this way. So you start to get an imbalance and an uneven tracking of your kneecap. So a lot of this is about loosening up the lateral structures, loosening up your IT band, loosening up your lateral quads, and strengthening that inner leg. In really severe cases, they will do a lateral release. They'll actually cut the fascial tissue on the outside to release that patella and let it track more medial. And then, if the wear and tear is bad enough, eventually then people have to have surgery, like a knee replacement, partial knee replacement, total knee, depending on what parts of the cartilage are really problematic. However, there's a lot you can do to keep this tissue balanced and keep the aggravation from becoming too bad. We just have, like I said, it's tricky, and it's about balancing of the knee, and we're going to do a lot of strengthening stuff to fix this, to talk about it. A lot of the hip stability and knee stability exercises that we talk about and the release is all about correcting this kind of stuff. So